anesthesia, to help people get off the battlefield, and to help in that regard. So what we learned was not only does it help with depression, but it helps numb pain. It does work really well as an anesthetic. So it started being used in Vietnam. It was called the buddy drug. So they would give everybody a pill, and they would keep it in their pocket, and if you got injured on the battlefield, you could administer it to your buddy, and he wouldn't feel the pain, but he also wouldn't have the memories or the trauma associated with how he got hurt. And the good thing about it is it didn't affect respirations or heart rate or blood pressure, so it didn't have to be monitored. Literally, one soldier could give it to another one. And what they noticed with these soldiers that had been given the ketamine was they too had less depressive symptoms than other soldiers that didn't. And not only less depressive symptoms, but they didn't have the traumatic stress, PTSD symptoms that other soldiers had. So then we started really liking this drug and wanting to know more about it. But in America, we first decided to start trying it in 1970 after, for an anesthetic. We started giving it in just the elderly and just children because it doesn't actually cause you to go completely unconscious. You can still be aware of things. It's sort of you get to kind of take a break. You can see what's happening, you know what's happening, but you're not feeling any of the pain, and it's just a good, relaxed, dreamlike state. And it worked really well in children because it didn't sedate them all the way, as far as making them completely asleep, but it just made them feel good and happy. So anyway, that's how it was first started to be used. So it got approved in the United States as an anesthetic in 1970. But that was the only approval from the FDA whatsoever, was the anesthetic. Even though a lot of other places and a lot of underground places, even in the US, were using it for other things. But it was only approved as an anesthetic. Anyway, so fast forward for a really long time. I started working at hospice, and we had a lady who had a neurodegenerative disease, and she was just miserable. Not pain, but very sad. Just she couldn't do the things that she wanted to do. She was limited, her movement was limited, she was isolated, and it was just not a very good situation. She didn't want to die that way, and I didn't blame her. And we had tried everything under the sun. And so luckily, I had a wonderful pharmacist in Phoenix who helped me find ketamine and said, hey, let's try it. Let's try it on her and see if it helped. And you know what? We gave it, and the next day her husband called and said she's not crying anymore. And I'm happy to say, and she would be joyous for me to tell you the story today, is she died peacefully and without tears, and it was the ketamine that made the difference. Her daughter later sent me a letter and said this drug was a miracle. It literally changed her life, and she died comfortably and peacefully. So after that, we started saying, well, if we could do this for this lady, what about other people who have pain and depression, who are suffering from neurocognitive disorders? What can we use it in those people too? So at that time, luckily, Casa was owned by Agnes and Lynette, who were local, and they were happy to let me play and experiment. So thankfully they let me, and we did a study on patients. We started keeping up with it, and we found that that 70% of them responded to this medicine. And that was a huge thing because most of these patients were going to die very soon, and we didn't have time to wait on those 4 to 6 weeks normal antidepressants. So this was, not only did it help with their depression, but it got them out of pain. And so we did the study, we published it, and we were invited to speak at the American Academy of Hospice and Palliative Care, and that was about 5 years ago. Even though we had to take the 7 o'clock spot, we were still very proud to get to present our research on the national stage. So since that time, ketamine has become super popular for depressive symptoms, but it's an off-label medication still, meaning that the FDA has not approved it for this particular kind of thing. So from there, we went to using it in palliative care, meaning that for patients that weren't necessarily dying, but were facing a serious illness, they were facing the thought of dying. And we started using it in conjunction with therapy. We have a licensed clinical social worker who I worked with there, but she's now part of ElderHealth. And together, the two of us would go out, administer the ketamine, and do these psychotherapy sessions with patients. And where normal psychotherapy takes maybe years for you to kind of figure out what's going on, this would work in about 3 to 6 sessions with the ketamine. So it was remarkable. In my whole career in medicine, and that's been about 20 plus years, I've never seen anything like this, like the way it's changed people's lives. It's transformative, really. So there's lots of good things about it. You can see it helps with pain. It works really fast. It only stays in your system for about 30 minutes to an hour. So it's pretty safe. Again, it's used as an anesthetic in children, so you know the safety profile has got to be pretty good. It's very unique in that it targets a lot of different areas other than just areas that deal with depression in the brain. It's very complex with its pharmacology, and most pharmacists call it a nightmare because we don't know how it works. It hits so many receptors, and that's why we think it works so well, because depression is likely not just from being depressed. There's probably a pain component to it. There's probably other things that are happening, and this is a great drug that hits many different receptors. And it doesn't require a lot of monitoring, which is scary to most people. So you don't have to worry about it changing your oxygen rate or interfering with breathing or your heart rate or anything like that. So that also made it a very good option for depression. Again, not FDA approved for this particular use. There is a nasal spray that just got approved about 2 years ago. It's extremely expensive. I'm not a huge fan, and that's a story for another day, but it's an old drug, it's cheap and safe, so why would you want to pay a lot for the nasal spray? Anyway, there are possible adverse effects if given in really high doses, but most of them we can offset with other medication. And again, it only is going to last in your system for about 30 minutes to an hour. So, if your heart rate is up for an hour, it might be worth it because you might not feel so yucky after it. So for the most part, the side effects are bearable, is what I'm saying. It's safe to use in any age range because, again, it's indicated. So a pediatric dose of ketamine to sedate them is like 900 milligrams, and the dosage for someone for depression is 0.5 milligrams per kilogram. So it's like 40 milligrams or 50 milligrams. So we're not touching that higher doses. So very safe to use on anybody. Now it's not, again, we never know how someone's going to respond to it, and that's why having myself or Laura or somebody else that's familiar with the medication, at least in the beginning, is good, so we can kind of help figure out the right dose, figure out how is best to use it. Now, the one thing I want to say about ketamine is it potentiates opioids, meaning that if you're on morphine or oxycodone or anything for pain, when you take the ketamine with that, it makes that particular drug work better and last longer, meaning you're going to get more pain control, but it's going to make it higher strength. So sometimes that's a good thing, and sometimes we don't want that to happen. So if you just take it and we can help you tailor it to make it the right, helpful to you is what I'm saying. That's why it's important to know that. Okay, so how does this relate to Parkinson's? How is it going to affect you on the ground? So what we do know about Parkinson's, what you see plastered all over TV, is Parkinson's is a motor dysfunction. You're going to see slow gait, and you're going to see, the hunched over person and the tremors. That's what we know about Parkinson's. But what we don't know, or what's not is publicized, is the other side of Parkinson's, and that's the emotional side. What we don't know is the emotional side of depression, of Parkinson's. But with Parkinson's comes depression. It's going to happen because it is not the way Parkinson's affects the brain. It also changes your affect and depression. And not only do you know you're going to be depressed or have those depressive symptoms, but those are the likely first manifestations of Parkinson's. They usually occur 4 to 6 years prior to the diagnosis of Parkinson's. or onset of motor symptoms. So it's those depressive symptoms, that flat affect, that just no desire to go out and do anything. Those are the first things that people have before they're diagnosed with the actual tremor or the shuffling gait. But we don't talk about that as much. But it's something we should, because it directly affects Parkinson's and how you feel and how your motor symptoms are. I'm going to talk more about that in a minute. So going back, let me go back. So stopping there for just a minute. So there is a new way of using ketamine, and I want to digress for just a second to talk about that. As far as the clinical features go, there's one drug, and it's been the mainstay for Parkinson's for many, many, many years, and it's carbidopa-levodopa. But if you've been on levodopa for more than 4 to 5 years, 50% of people will develop motor symptoms, involuntary motor symptoms because of the levodopa, meaning that you'll have something called dyskinesia, where there are involuntary symptoms that can be very disruptive to your life. And that, again, 50% of people will have that if you've been on the drug for 4 to 5 years. If you've been on the drug for 10 to 12 years, 80% of people will have this. So there is a physician at the University of Arizona, Dr. Sherman. He actually figured out that doing ketamine infusions in the hospital for a certain amount of time can reverse that involuntary effect that the levodopa causes. And I'm glad to say that his research has led to a new drug that's in phase 2 trials now, just for this particular type of thing in Parkinson's. It's very unique. It's very specific to this. But so that particular way of using ketamine is for that particular thing that happens. But it's definitely something, as we live longer with Parkinson's and we know how to manage the disease, more and more people are going to suffer from it. So glad to have that going. And he actually does administer those treatments here. Again, one of the only people in the world that does this. The drug that's been in trials was based on his research, his initial research here. So he's the only physician I know that does this right now, but it is available. You have to see him at the university to get it done, but it is there. Okay, so now I'm going to talk more about the emotional side about Parkinson's, because that's where I'm going to use ketamine more. So depression in Parkinson's is usually caused by 3 things. The first thing is what normal depression in people are called. It's this imbalance, this chemical imbalance in the brain. The dopamine, the serotonin, norepinephrine levels are off in your brain. And so you can imagine if you have Parkinson's, which is related to the dopamine in your brain, that those levels are going to be off. So naturally, there's going to be this component of depression. So that's one factor that causes it. The second one is your overall immunocompromised. So that creates the likelihood of having depressive symptoms. And the third thing is the microbes in your gut. We know that Parkinson's causes those to they're not the gut flora that's normal for most people, and Parkinson's is different. So the flora in your gut changes. All 3 of those things are factors in causing depression and Parkinson's. So again, it's a symptom of Parkinson's, just like the motor symptoms. It's going to happen. Now, what do we do about it? And why do we want to do something about it? So the importance of treating it is, again, because it's going to be there and it's going to happen first. So that's important. So going back to the heredity factor, if you know somebody in your family has Parkinson's, then you start to look for those depressive symptoms, because that may give you an insight that there's a Parkinson's motor symptoms coming. So that's important. But second of all, if you have Parkinson's and you don't treat the depression, it's directly associated with the symptoms worsening, your motor symptoms worsening, and being resistant to the medication that we have out right now to treat Parkinson's. So that symptom alone, untreated depression, leads to motor symptoms being worse and treatment failure. So very important to treat depression. So the other thing is, and it is the main non-motor symptom associated with Parkinson's. But again, can't stress enough the importance of treating it, because if you don't, it doesn't matter how good you are at treating the motor symptoms, it's likely not going to matter. that make sense?
Question.
Sure. So Karen asked if you are on carbidopa-levodopa and if you have the depressive symptoms and they're treated with ketamine, is it a possibility that you could go on a lower dose of the carbidopa-levodopa? And the answer is yes, absolutely, because if we think depression, we know depression is a factor in it, and we know that depression has a direct link to causing the symptoms to be worse. If we fix those symptoms, then certainly we expect the carbidopa-levodopa to work better. Not saying that would be the case, and there's other factors involved too, so it's not going to necessarily be that way in every case, but definitely it's something we should shoot for. If you know that's something that's off, then we definitely need to work to correct it. There, again, it makes ketamine be a really great option because it works so quickly. And the goal being not necessarily that the ketamine be the only thing, but it can be in that situation where first you start to notice it and you want it better because you want your Parkinson symptoms to get better, or you may not have a lot of time left, or you may be in the very beginning. But it can be a jump starter, meaning we can use the ketamine to kind of get you back where you need to be, and then we can use some of the other antidepressants that are on the market to keep you there. Or we can give the ketamine, and again, we expect there to be dips and valleys as the Parkinson's progresses. So you can use the ketamine when those dips and valleys occur, again, to kind of get you back at your baseline. That makes sense. So 2 ways that ElderHealth uses ketamine. The first one is the compounded route. So again, not FDA approved, so we can't write you a prescription and say, go down to CVS and get it. You have to, when the FDA approves medication, they approve it for one purpose. So they approved original ketamine for anesthesia. That's never going to change. But we have wonderful compounding pharmacies that can make ketamine, and again, it's dirt cheap because it's old. So, nobody can recreate it. So there's not a lot of drug companies that are trying to buy it and make it be something different, because you can't do that with it locally. But we have 2 here there's 2 pharmacies here in Tucson that will compound it. One is on Orange Grove, it's Acacia Compounding Pharmacy, and the other one is Prescription Laboratory on Grant. There are other compounding pharmacies, but I know that those are the only 2 that actually do ketamine. And they can do it any way you want it. They can do it in a nasal spray, they can do it in a lollipop, they can do it in these little troches that go under your tongue. They're amazing in what all they can do with it. So 2 options of giving it. So one option is just giving you the prescription for the compounded drug, and in low doses, most of the time, again, with our assistance or with somebody that's knowledgeable about ketamine's assistance, then we can teach you how to do it at home in ways to alleviate depression and pain with the oral dosing. However, in some cases, when you're trying to achieve a certain goal, or the depression is related to a certain thing, maybe that you're concerned about end of life, or you're concerned about the diagnosis, you just got it and it's overwhelming, then there may be that necessary component to have the ketamine administered along with psychotherapy. And that we come to your house to do. So we come to your house and we come in, and Laura, the social worker, she usually meets you beforehand. She gets to know who you are, kind of what the goals of the ketamine are. So she kind of can help guide you through that journey once the ketamine's administered. In this particular use, and I like this use, especially for first-time people to take ketamine. Again, that the part of it with Laura helping is to kind of guide you into where you need to be thinking when you take the ketamine. And then usually I'm there with you, and we give it in a higher dose in an injection form. And then we guide you through this about an hour-long journey of therapy. Sometimes that's all you need. We leave and you don't see us again. Sometimes you do that session and you need another one of those sessions, or sometimes you have that session and we can send you home or give you the oral dosing to do it on your own at home. It's a very unique medicine, and it's very unique in how it's administered to people. It's very designed specifically towards your situation. The other thing we use with the psychotherapy sessions is our music therapist, because we know that sometimes in our subconscious there's there's channels we want to access that we can't consciously get there, but music can take you there. And not only can it take you there in the session, but you can use that music ongoing after those sessions to get you back in a good place, meaning that the music that's used in the sessions will be something that can be left with you to say, when you're starting to feel those low points, you can use these songs. Or you need the relaxation, use these songs. So it's a way to keep those brain waves that map kind of solidified from the first session. And again, it's remarkable in its own right, music therapy, but added to the ketamine, it's just amazing. So her son lives in Las Vegas, and she was asking if he goes to his physician and asks about this medicine, would the physician there know about ketamine? Most likely he wouldn't. That's not to say it's not available. It's something that he would probably need to research, again, and not specifically related to Parkinson's. Just look up ketamine in treatment centers in that area, and I think he could probably find someone that was available. It's just not most physicians are not using it in this way in practice, not because it's not safe, but because they just don't know about it, don't understand it enough to feel comfortable prescribing it. So Michael Pollan, he's just wrote a book that came out about 3 years ago. It's called How to Change Your Mind, and it's a book about psychedelic medication and how before we kind of, this is the LSD, mushrooms, all that stuff that we kind of said they're bad, war against drugs, we don't want them. But what he said, and he's a journalist, and he went on this mission to see, is there a place in medicine for these drugs? And he found out there is. There always has been. When used appropriately, they can do amazing things to your brain. And this quote is really what we intend for ketamine to do in the brain. Habits are undeniably useful tools, relieving us of the need to run complex mental operations every time we're confronted with a new task or situation. Yet they also relieve us of the need to stay awake to the world, to attend, to feel, think, and act in a deliberate manner. Meaning that our brain creates habits, they create pathways. So every day you wake up and you don't have to consciously think, I need to go find my toothbrush and brush my teeth. It just naturally does that. But what ketamine does is it takes all that natural habitat in the brain and it just picks it up and throws it back down, which looks like this. So this is your normal brain every day. This is how many neurotransmitters one line goes to the next one. But when you take the ketamine, this is what it looks like. So your subconscious holds an array of ways of looking at the world that we don't utilize. It's just stored back there, just not doing anything. So once you take the ketamine, again, it drops those neurotransmitters down so that they can reconnect to different places, so that you see the world in a different way. So you're using your own mind to help with the depressive symptoms. That makes sense. So anyway, these are the two books that I really love that talk more about this particular method of using ketamine. The Michael Pollan book, and he doesn't talk about ketamine specifically in that book because it is a prescription drug, and he talks more about off-label like LSD, non-prescription drugs. But the concept is the same. And the second one is the ketamine papers. And this man, he's the guru. He's a psychiatrist in California. He wrote the book literally on ketamine. So he started in the beginning, and he was one of the first ones to use it in psychotherapy and had really great success with it. Okay, so that's basically what I wanted to talk to you today about is the role that ketamine can play in Parkinson's, is specifically with depressive symptoms. So what do you think?
Sounds good.
So we can talk about it more. You can always email me, and that's on our cards to ask more specific information. Those are the best resources that I can say I 100% feel confident in what they're saying about ketamine. You can look this up and you're going to get a whole lot of things, and I can't say that all of it is going to be accurate. I can tell you for sure that the information in those particular references are.